My name is Mike. I'll be your nurse practitioner for today.
Nice
to meet you.
Nice to meet you.
So I see this is your first time in our office. What brings you into the office today?
Well, I've had some bloody sputum, just a lot of blood lately, and I'm starting to have some pain over on my right side of my chest.
Okay. How often are you coughing?
Coughing about once an hour or so.
Once an hour?
Yeah.
How long has this been happening?
The coughing started about 4 months ago, and then the bloody sputum started about 2 months ago.
So you've been coughing for around 4 months, and for 2 months you've noticed blood.
Yeah.
And how many times a day would you say you cough up bloody sputum?
Oh, probably once an hour.
Once an hour?
Yeah, at least.
Is it worse at a certain time of day?
Yeah, it's definitely worse in the morning.
Okay.
For sure. When I wake up.
Along with the cough, have you noticed any shortness of breath?
Yeah, I get pretty winded now when I climb the stairs.
Okay.
Yeah.
And you said you were having some chest pain as well?
Yeah, over on my right side.
To the right side of your chest. Out of 10, 10 being the worst, how badly would you rate the pain?
When I cough with my chest, it's about 7's the worst, and then it's kind of constantly there.
Constant.
So it's a 5 when I'm not coughing.
Okay. What does it feel like?
It feels like a stab when I cough, and it's kind of just a strong throb and ache when I'm not coughing.
Okay. Have you tried to take anything or do anything for the cough or the pain?
I tried to take Robitussin and I tried some NyQuil one time, but it really didn't work.
How often did you take it? Did you take it consistently?
Yeah, and that's why I'm here, because nothing's
It's
working.
not working. I gotcha.
Yeah.
Okay. So I'd like to ask you a few more questions about your history, your personal history. Do you use tobacco products?
Yes, I smoked for 30 years.
30 years, and how many packs a day do you smoke?
Just a half a pack.
Half a pack a day for 30 years? Okay, and what do you do for a living?
I'm a chef.
You're a chef, that's amazing.
Yes.
What kind of food do you like to cook?
I'd like to cook just anything. My favorite food's French.
That's great. So you're in the kitchen a lot at the
Yes.
restaurant. Okay, gotcha. Do you drink alcohol?
Just occasionally.
Occasionally. How often do you drink when you do? How much?
Maybe just a glass of wine here and there, or maybe a cocktail, but just one.
Just one?
Yeah.
Okay. A couple times a month?
Yeah.
Okay.
Maybe that, if that.
Sure.
Yeah.
Now tell me, do you have any family history of cancer, cardiovascular disease, anything like that?
My dad died of lymphoma, and then my grandfather died of lung cancer.
Okay, and do you know how old they were when they died?
My dad died at 54, I believe, and then my grandfather died of lung cancer around 80.
Okay.
Yeah.
And do you mind telling me what type of home you live in?
I live in just a regular house. Well, when I was growing up, I used to live in a basement. That's where my room was for about, 20 years until I moved out.
Okay. And was it an older home?
It was a much older home, yes.
Okay. All right. I also want to ask you, have you traveled anywhere recently?
Well, I traveled to Japan and back, but, that was maybe 6 months ago.
Okay. How long were you there?
Just for about 2 weeks. It was just vacation.
Okay. Gotcha. So your main concern today, it sounds like, is your cough with bloody sputum, along with the right-sided chest pain. Is that correct?
Yes.
All right. I just want to ask you a couple more questions to try to figure out what's going on. Have you noticed any weakness, fatigue?
I seem to get tired more than I notice myself taking naps a lot more often. But
Throughout the day?
yeah, throughout the day.
Okay. Have you noticed any fever, chills?
Sometimes I wake up sweaty.
Okay.
Sometimes maybe a chill or two, but nothing major.
Are you waking up during the night?
Yeah, the cough will wake me up during the night.
cough and the sweating overnight,
Yeah.
okay. Any recent changes in weight?
Yes, I've lost weight,
You've lost weight. How much weight have you lost?
20 pounds,
Over what period of time?
3 months.
So over the past 3 months, you've lost 20 pounds.
Uh-huh.
Was this intentional?
No.
Have you made any changes in your diet?
No changes.
Okay. What type of what type of foods do you usually eat?
I like fruits and vegetables, but I also like chicken and beef and all that.
Okay, that sounds pretty well rounded, and you're a chef, so
Yes.
I'm sure you have access to a lot of good food.
Oh, I do.
Okay, great. Have you experienced any trauma recently to your face, your mouth, your head?
No trauma.
Okay. Any headaches?
No, I mean, when the pain gets bad, my head can start throwing, but when the pain subsides a little bit after coughing, I'm okay.
Okay, so sounds like from the cough can
Yeah.
make your head hurt a little bit. Okay.
Yeah. Some extra pressure.
Gotcha. Any changes in vision?
Not recent, no.
Okay. Have you noticed any bleeding from your nose?
It's usually in the morning, it can get pretty bad. And I have to lay on my right side, I notice. And sometimes I have some blood when I cough, will sometimes come through my nose.
So when you say blood from your nose, have you noticed it coming from primarily your mouth into your nose, or is it coming out of your nose specifically?
It's from my mouth.
Okay.
And it's just, yeah.
It's draining out.
Yeah. It's just like the cough is strong and
it's okay.
it gets up there.
Gotcha. Any sneezing?
Occasionally, not.
Do you have seasonal allergies?
Just sometimes. Not much really bothers my nose.
Okay. Just to circle back, have you made any changes in medication?
No, I don't take much medication.
Okay, I saw in your chart that you weren't on anything when you listed your medications other than the occasional Robitussin. I just wanted to make sure that you weren't. How about supplements?
Multivitamin, vitamin D, biotin.
Okay.
Yeah.
Okay, great. Now, you said you have this chest pain and it's only on the right side. Have you noticed any palpitations?
No, I haven't noticed any palpitations.
Okay, any swelling in your legs or extremities?
No swelling in my legs or extremities. I have a little bump I've noticed underneath my armpit.
Okay, so you have some swelling there?
Yeah, maybe that's what but to me it's a bump.
It's a bump. And any other bumps that you've noticed?
There's some bumps on my right side of my neck, but I haven't, it's not on the left, it's just on the right. I just
on the right.
Some bumps up here.
Are they painful?
One down here is, yeah, I just noticed.
Okay.
It is a little tender, yeah.
How long have you noticed these bumps for? When was the first time you noticed?
I'd say I started noticing it about maybe a month and a half ago.
Okay.
Yeah.
All right. And your voice sounds pretty hoarse. Is that normal for you?
No, I mean, usually I can get over stuff, but lately it's just been, I'd say, probably the last 2 months.
Okay.
Yeah.
Gotcha.
Uh-huh.
All right. And you've already told me you felt short of breath. Any abdominal pain?
No, sometimes it aches up in here. It aches up in my chest up here.
How about your belly?
No.
Okay. Any strange tastes in your mouth? Sour tastes?
No, just blood.
Okay. Have you noticed any changes in bowel patterns?
No, everything's pretty regular.
Okay, everything's regular. The consistency of your bowel movements is regular. Any blood in the stool?
Not that I can see.
Okay. Any bleeding in the urine?
No.
Pain when you urinate?
No.
Okay. Anything else going on today that I should know about?
No, I think that's it.
All right. So if you don't mind, let's get into our physical examination. And